Head is visiting several facilities in the Western Cape today. These include the mRNA vaccine technology transfer hub and others that are helping in the response to COVID-19 and protection of public health in South Africa. Now, speaking to the media in Cape Town, the organization's chief scientist, Dr. Soumya Swaminathan, says they expect more COVID-19 variants and it's not the end of COVID. Now, she's urged everyone to vaccinate.
So we know that there will be more variants of concern, and so we're not at the end of the pandemic. To get to that stage, we need the world vaccinated, because unless everybody around the world has immunity to this virus, we cannot bring down the deaths. We're still seeing huge number of deaths every day. I looked yesterday at the statistics. We had 11 to 12,000 deaths happening daily per week, every day in the last week. So this is not an acceptable situation for us to be in. Most of the deaths are occurring in unvaccinated people, and this is another reason why we need to scale up manufacturing. We need equitable vaccine distribution.
There are companies all over the continent which are lining up to work with Afrigen and with what we're doing here in order to massify and scale up the vaccination. We have listened to what they've said. The Director General will be meeting with the President later today, and those are some of the discussions that they'll be having to try and see how can we resolve some of the blockages, particularly as it relates to scaling up production, and hopefully by the end of next year we will have vaccinations that are locally produced.
President Cyril Ramaphosa has welcomed the oversight visit by the WHO. He met with WHO Director General Dr Tedros Ghebreyesus, who is being accompanied by Belgian Minister of Development Cooperation, Mariam Couture. The two are in a two-day visit to various vaccine sites in the country. Now, this visit is in line with the showcasing of the country's capacity and infrastructure in the development of vaccines for COVID-19 for the African continent. Now, let's get an update on Tedros's visit. We are now joined via Zoom by our reporter, Bulelani Phillip. Bulelani, thank you so much for your time this afternoon. Now, we did understand that President Cyril Ramaphosa was meant to meet the WHO director by this evening, but we understand now that they've already met. Talk to us about what is expected from the WHO visit today and where they are likely to have activities planned for the day.
Well, good afternoon to you, Unati, and to the viewers at home. A short while ago, the presidency, of course, confirming that President Cyril Ramaphosa had in fact met the WHO Director General, Dr. Tedros Ghebreyesus. But, part and parcel of their discussions is to ensure that as President Ramaphosa is the COVID-19 vaccine champion for the African Union, that Africa remains self-sufficient, because this debate actually goes back about 2 years ago when this outbreak took place. You'd find that developed countries who had the resources as well as access to these vaccines had actually hoarded these vaccines and only actually released them to developing countries when actually it was a bit too late in some countries, and when they had actually vaccinated the vast majority of their citizens. So in this context, Africa taking the lead of having its own manufacturing vaccine hub is to ensure that in any eventuality where vaccines are needed, they do not have to rely on the West. They can actually have their own manufacturing hubs and companies and factories that could easily assist their citizens. So we must look and locate this context of this project in that context, as well as it's not only South Africa that's going to benefit here, it's going to be the rest of the African continent. And if there are excess doses that are coming from the African continent, those could easily be sold to other African countries. So the theme here is that Africa must be self-sufficient, and the WHO Director General is part and parcel of the people who support that developing countries must be self-sufficient in their healthcare system. Unati?
In fact, that's something that the UN has raised repeatedly, as the world fights COVID-19. That one of the things that it has shown is how the rich countries have essentially been hogging vaccines. So I must say this is a significant event. How has the WHO's presence in South Africa been viewed by particularly the health fraternity and scientists overall in the country?
Look, essentially, Unati, this is a significant visit by the WHO because, one, it confirms that Africa does have the research capacity as well as the infrastructure to actually, do the research around vaccine and develop its own vaccine. Because you'd understand that given the geopolitical politics that we are in, there's always the issue that African countries or developing countries do not have the capacity to do all of these things. But this is a demonstration that African countries can in fact have the capacity to develop these vaccines as well as be able to support their counterparts on the continent and in fact even go beyond that and support other countries around the world. So this is quite significant. And again, the visit by the highest leadership of the WHO also shows that the support that South Africa and the African continent are getting is coming from the highest level, which means that as a country and as a continent, we are on the right track. But of course, we are looking forward to, the press conference that will be given by the WHO Director General in just less than an hour's time at 4 o'clock to see, what are his reflections on what he has seen, given that he's gone and visited several of these sites that will be used as the manufacturing vaccine sites. Unati?
I'll tell you what, Bulelani, before I let you go, one of the things that I would like to hear from the director is what essentially the chief scientist for the WHO said earlier to some of you, Dr. Swaminathan, saying that more COVID-19 variants are to be expected and that it's not the end of COVID-19. How was that also met? Her obviously encouraging people to go out there and vaccinate. It was one of the biggest concerns that after Omicron, what is next? What will the world be battling in terms of other variants?
Well, that's a question that has been on people's minds because we have been used to this thing that after each and every variant, months or just a couple of months down the line, there will be a new variant that has evolved. And since the emergence of Omicron, we have not quite seen, it's been quite a longer period of time when we have not seen a mutation of the virus. So we've asked the WHO whether what is their outlook, what is the landscape outlook of whether there could be another variant that comes up. And the answer is simple, is that at this stage they are not quite certain how the landscape looks like, but they do believe that there will be more variants and there will be more variants. In fact, how they quote it, more variants that are of concern. I think that's the emphasis, unquote. But of course, the issue that they are emphasizing is that in order for you to be safe or reduce your chances of getting complications is that get tested. And of course, we've also spoken to some of the researchers here in the genomics unit here at the Stellenbosch University, also confirming that they don't rule out the emergence of yet another variant, but it's too soon to say when will that happen. Unati?
Bulelani, thank you so much for that update. Of course, we will be keeping track with you on this particular visit. Thank you so much. That's where we have to leave it for this afternoon. That was Bulelani Phillip. Of course, he's tracking the WHO's Director General, Dr. Tedros Ghebreyesus, who is today visiting South Africa's vaccine sites. He's already met with President Cyril Ramaphosa. Let's continue here now.